Hi there, I'm Dr. Timothy Chips from Chips Dental, and I am going to be talking to you today about a problem that most people are coming in to talk to us about anyways, and it's about cavities. And so what we're going to talk about is where cavities come from, and we're going to talk about how diet affects that, and we're going to talk about home care and how proper home care is very important to this, and we're going to talk about different things you can use besides just your basic toothbrush and floss and fluoride and mouth rinses to help manage this decay and fight against it. And the last two things are about coming into the dentist and about making sure you're coming back in regularly. So let's start with where do cavities come from. Your teeth are a mineral. They're a mineral content of your body. In fact, the enamel of your teeth is the hardest substance in the human body. They are susceptible to attack by acidity. Okay, and acidity can come from a number of different places, but the most basic one is from our food. We all know that dentists want you to stay away from sugar, but nobody really knows the exact reason why except the dentists. So here I am to tell you what happens. There are bacteria that live in your mouth, and they're in everybody's mouths. Okay, some people have more of them, some people have less of them. Some people's strains are more active and busy in creating more cavities than others, but they're there. They're there in everybody's mouths. And so what we want to do is understand the process by which they're creating acidity in our mouths. So when you have food, any meal, even if you're having a high protein Dr. Atkins diet, there's still some carbohydrates in that meal. So the bacteria that live in your mouth, they ingest those carbohydrates, and the byproducts, the waste products, are carbon dioxide and lactic acid. Lactic acid is what is in your mouth then. And so in a normal environment, in my normal mouth here every day, when I have breakfast, about 20 minutes after breakfast, the saliva in my mouth has neutralized that acidity, and my mouth goes back to feeling normal. There's no more demineralization of my teeth. Okay, and you're going to hear me talk a lot about demineralization and remineralization and why we're trying to favor remineralization in our body, in our mouth. So that's basically it. The sugar gets eaten, or the carbohydrates get eaten by our bacteria, and they make carbon dioxide and lactic acid. And so that process creates an environment where the mineral content of our teeth is being dissolved by the acidity. There's actually a critical pH at which your teeth start to dissolve, and that's something we can have an effect on. So what I'm going to move on to now is our second point. The second point is about our diet. Let's say, for example, you are somebody who loves to have a little bit of soda or pop, and you just keep that around all day, all right? You just have a little bit all day, every day. It's just part of what you do. You know, maybe it's, keep it on your desk at the office, or if you're, work outdoors, you keep it with you on your truck or whatever it is, and, every 10, 15 minutes you go grab yourself a little swig of that pop. What happens? What's going on in your mouth? Because those people that have that going on, I see a very high rate of decay in, and here's why. So we're going to look at a graph here. And what I do, it's just a line graph, and it shows acidity. And we're going to assume for right now this is my mouth. Okay, and so here we have acidity on the one column, on the one side, and time. And we're going to look at breakfast, lunch, and dinner. I rarely do anything that has added sugar in between meals, and so this is a pretty accurate graph for me. So here we are, I'm going along, and I have breakfast, and there you see I have a spike in my acidity, and about 20 minutes later it goes back down to normal, a normal, neutral mouth again. And it goes along and stays that way till lunchtime when I have my lunch, and it spikes, and it goes back to normal again. And then lastly, you see a third spike right around dinner. And I'm going to draw a little line across this graph where that pH is that starts dissolving my teeth. Okay, boop, 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 boop. See it right there, okay? And what you see now is how much time, and it's like the area, the time spent above that is how much time my teeth spend in the acidic environment that dissolves them every day. So I have a mouth that favors remineralization. And I have a couple other things going in my favor, not the least of which is that I'm a dentist and understand all this. But that's another topic for another day. What we're going to show you now is our friend the pop drinker. And here's what happens. So we wake up and we might actually have a neutral mouth at this point. And we have our breakfast. And about 10 minutes after breakfast, we crack open our first bottle of pop. And we have a little sip. And we have another little sip about 10-15 minutes later. Another little sip 10-15 minutes later. We run all the way through that time between breakfast and lunch, and we're having a sip of pop every 10 to 15 minutes. And you'll see our mouth has no time to neutralize that acidity. It just stays way up in this acidic zone. And guess what? Right after lunch, it just keeps creeping back up, keeps creeping up in dinner. And finally, when we go to sleep, because we can't drink pop overnight, our mouth is finally able to maybe recover it and get back down to that neutral mouth, that neutral pH. And pH refers to the acidity in an environment. So that's the amount of acid present. So we're going to go ahead and draw that same line. And if you look at that line, boop, 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 okay, now what do we see? We see that we've spent all day in this environment where our teeth are being dissolved. And so it's almost common sense at this point why this person is having so much trouble with decay. It's because they're just letting their teeth sit in an acidic environment all day long. So that is the first thing that has to change in some cases. Now there are some other times when this same thing happens and it's not necessarily related to diet. Some patients have severe dry mouth. When you have severe dry mouth, you have the same pattern happening because you don't have enough saliva to neutralize that acidity. Okay? Now, this all happens assuming you're still doing good, perfect home care. Even if you brush your teeth right after doing all this stuff, you will still get cavities if you're doing these activities where you have severe dry mouth. Okay? You can have perfectly healthy gums and you can brush everything away, but if your mouth can't neutralize that acidity, because it's constantly there, you're going to get cavities. And so we have to change that. We have to eliminate. So what do? We eliminate the food source. We eliminate the sugar that's going into this. Okay, and this could also be other examples of where this can come from. Let's say you take a little hard candy and you pop it in your mouth to help keep your mouth moist and more comfortable. Well, that's doing the same thing. You're bathing your teeth in acid because what happens, that sugar's in your mouth all day. It does the same thing. So this is something that is really one of the cruxes to what we need to do. We need to address that habit, whatever it is. This also can apply if you are medically compromised. You're having, you have many different medicines. You can end up with dry mouth. Also, if you are a cancer patient, you can end up with a lot of these same things. So that is the first step, is changing our personal habits and eliminating that food source for the bacteria to turn them into acid and creating cavities. Now, the third point was about home care. Okay? Now, with home care, what are we doing? We're brushing our teeth. And we talk about flossing, getting in between our teeth. And I go to classrooms all the time, and so do my hygienists and assistants, and we talk to the kids about home care, and they all know 2 minutes twice a day. You brush for 2 whole minutes. Believe it or not, the average person only brushes for about 37 seconds. Okay? 2 minutes is almost 4 times that amount of time. So realize it's going to feel like you're in there brushing forever, and you really want to pay attention to where your brush is going. You also want to be very careful you're not applying too much pressure. You are not scrubbing a stain out of your bathtub. You are trying to gently massage all the bacteria away from your teeth. Okay? So no more pressure than you can apply to your toothbrush with 2 fingers. All right? And once we do this, and you should probably set a timer or get an electric toothbrush. They all have timers on them nowadays. You can get one at our office. And when we talk about rinsing, what do you want to do with your rinsing? Well, if you are somebody who has a high rate of decay, ensuring that we're using enough fluoride, topical fluoride. It's in our toothpastes. It's also in a lot of mouthwashes. You want to find 2 of those that work well for you. Now, this is topical. We're not going to be ingesting this. Sometimes people get a little upset about the use of fluoride, but I'm going to tell you that the science tells us that daily topical application of fluoride makes your teeth more resistant to decay. So we're going to go back to our graphs. Remember those graphs we had showing me versus somebody else? So if we are using fluoride daily, topically, so you spit it back out with both the rinse and the toothbrushing, what's happening is we're making our teeth more resistant to acidity. They will not dissolve at the same pH. It has to be more acidic for them to dissolve. And so what happens is that little line we drew across there moves up a little bit in that acidic scale. And so now you can see less time's being spent in the my teeth are dissolving in my mouth stage. And so we're fighting against it, okay? And this is something that occurs over a long period of time. It takes a long time with daily use to really achieve this result, but it is effective. And the studies show us that. I had to read them all. Put me to sleep a couple of times, let me tell you. But it's true. It's shown. In fact, in addition to providing a fluoride program for our young patients and children patients, we also have an adult fluoride program for people who are higher risk. If you are interested in finding out more about this, please ask at your next appointment or when you come in, and we can help you understand how it can be beneficial to you, especially based on your risk for decay. Okay, so we've talked about how fluoride helps us and home care helps us, and now we've talked about what we can do with our diet and how that helps us. So now we're going to talk about some new things, something called xylitol. Xylitol is one of my favorite things. I'm going to tell you why. It is a fairly ubiquitous substance now. It's found in a lot of places. And you do want to be careful. If you are young and still growing, some of the products that contain xylitol will contain that aspartame, the stuff that a lot of parents are concerned that about giving to children. It's found in diet pops and whatnot. And I will tell you that's just something you have to be aware of. Make sure you're watching out for it. In the office, we usually have available some products that are sweetened with only xylitol and do not have any sugar substitutes other than that in it. And those are very effective at helping us. And what those do, what the science shows us there, is that it targets those bacteria that cause tooth decay, the ones that actually create the acidity. So remember, we battled it by making it harder for it to dissolve our teeth. Now we're going after the bacteria that are causing this in the first place, okay? And there's a couple different processes. There's something called a biofilm, which grows on our teeth every day. It's part of why we scrub our teeth with the toothbrush, okay? And what it does is that, the little sticky stuff that you find after a long day where you maybe didn't get a chance to brush after lunch, you get home and you feel run your tongue across your teeth and they feel kind of like icky and cruddy, right? If you know that feeling, you know what I'm talking about. That's called a biofilm, and that's a normal process. It also aids in the creation of decay because it makes a place for those bacteria to grow and multiply and have more of them right up against the teeth and make that little tiny environment right up against the teeth more acidic. So what this does, it targets the bacteria that create that biofilm as well as the ones that create the acidity, and it disrupts their processes. Some studies show us that it actually kills the bacteria that cause tooth decay, but it also, that biofilm is a big part of the decay process. It disrupts the ability of it to create these structures in our mouth. And so now it has a harder time creating the biofilm on our teeth, okay? So we're attacking the bacteria that cause this as well. And this, used several times a day, which I recommend to patients who have a high rate of decay, is that you go ahead and use xylitol regularly, 4 to 5, 6 times a day. Found in chewing gums and in mints and even some candies. A lot of those are available online. You can also find them at the supermarket. There's none in particular that I endorse. I just recommend using it, especially if you have a high rate of decay. They're very safe. There's very low side effects. Some people say they're a laxative, but the amount you would have to ingest for it to give you any digestive issues is astronomical, and it's way more than you would find in the 5 to 6 times a day that I'm recommending using them. Also, if you are one of those patients that suffers from dry mouth, guess what you're doing by using this? You're stimulating saliva flow in your mouth, so you're actually going to help it to neutralize some of that acidity more. There are some other products that we can use as well for patients with dry mouth, but that is a very detailed conversation which I like to have with patients individually. So there's a lot more available now than has been available ever before, and it's not just the biotin that I know that everybody knows about that they market on TV. There are many other products available which can be extremely helpful to patients with dry mouth. So we want to make sure we're going after all this in the right way so that we're not coming in here every 6 months and I'm telling you have 2 or 3 cavities. And that's what we're really going after here, is trying to get to that point where I can tell you that Mrs. Smith will see you again in 6 months. And you are just glad to hear that because it's been so long since you heard it. So then the last 2 points are actually some of the most important ones. So even if you're doing all this and you still have cavities in your mouth, guess what? Those are sources for decay. If you still have it in there, it is a contagious disease. It moves from one tooth to the next, from one area of the mouth to the next. So having that all treated is a very important part of the process. You need to make sure that's done. And so even though it seems self-serving, it is really important. That's what you're coming in for, is to address that issue. And so that is what's got to be our highest priority, because the first 4 points here I'm relying on you to do. And so now you're coming into me, you need to rely on me to manage all the decay that's in your mouth effectively. So we're going to go after that treatment plan and complete it. The first thing we have to do is get rid of the decay and the disease that's in your mouth. Then we can rebuild. And it's not always a race, it's a roadmap. We can get from point A to point B as it fits best for you. And sometimes if it takes longer, there's more things that have to happen along the way. But the important thing is getting that first step done, getting it complete, getting rid of the decay. And then the last point is your 6-month visits. If you get all this work done, and you have all these areas where decay's been cleaned up and you're really happy with everything, and then you stop coming in, I can't check on it. I can't make sure that I'm looking at everything underneath my, I have those magnifying glasses that, show you me really up close, everything that's going on. I look through everything with a fine-tooth comb whenever you're in for your checkups. And if I don't get a chance to do that at least every 6 months, problems go from little tiny problems that I can find then to bigger and bigger problems, just like what happened to get you to this point if you're somebody who's suffering from severe decay. All right, so to manage that, we have to make sure that every 6 months you're in here so we can look at it all and make sure that we're checking on it. We're not looking at comprehensive dental care where you have to have a lot of work done. We can keep it to smaller, tinier things. And in some cases where you're somebody who's just kind of always had a cavity or two every visit, might be able to get you down to 1 or no cavities every visit. If you need something more detailed or customized just for you, I would love an opportunity to talk to you about all that. If you're not a patient already, come on in and we'll go ahead and go over all these details and help come up with a treatment plan and make things easier for you and help you, fight back against that decay. If you're my patient right now and you're looking at this in my office and you have concerns, ask me. I'm really here to help. I love nothing more than be able to help you and to be able to say, Mrs. Smith, Mr. Jones, thanks for coming in. We'll see you again in 6 months. And I will look forward to seeing you.